groundbreaking research right here in southeastern Wisconsin.
And it means relief for hundreds of thousands of people with lower back pain. Fox 6's Jenna Sachs with the 25-minute procedure that's changing lives.
We find Jen Christensen making waves and getting kicks at the Wisconsin Athletic Club. 3 years ago, we wouldn't find Jen anywhere near a pool.
I could barely sit in the car. Tears constant, just the pain was so severe.
The woman who once ran marathons and taught Zumba was practically bedridden.
The pain is so debilitating.
Jen had severe back pain. Its source hard to pinpoint. Doctors traced her pain to something called the SI joint, located between the base of the spine and the hip socket. Jen's only chance for relief was signing up for a new clinical trial.
I'm not going to say I wasn't scared.
It was tough to look at her. I mean, she was so miserable.
Dr. Clay Frank was the trial's lead investigator.
We examined Jennifer. It was hard because she was so sick.
Dr. Frank enrolled Jen and nearly 150 others in the study.
This is where it all happened.
Yeah.
Do you remember what room number you were?
Jen was among half the trial's patients randomly selected to undergo a new surgery.
What we found was so profound.
After 8 months of pain, Jen came here to the Midwest Orthopedic Specialty Hospital for a 25-minute surgery that would drastically change her life.
It was a higher power. It was so meant to be.
She underwent SI joint fusion surgery, a new minimally invasive procedure that inserts 3 titanium bars into the joint.
They're about as long as my pinky.
The surgery involves a small incision, pushing the muscle fibers apart to get to the bone, then inserting 3 wires to guide the triangular bars into place. Then the bars are pounded into the joint with a 4-pound mallet.
There's a lot of hammer swinging to get them in there.
Frank found the number of patients with pain relief after surgery was 80%.
I've been doing this 20 years. I have never seen a tool this powerful.
Jen says her relief was immediate.
That sciatica-like pain was gone.
As a thank you for changing her life.
So I have something for you.
Jen presents Dr. Frank with a signed cover of Neurosurgery Journal.
Dr. Frank, thanks for fixing me and giving me my life back.
It's been 2.5 years since her surgery.
Thank you so much.
Their study made the journal cover and was honored by its editor.
I have to have tears in my eyes.
Yeah.
Every shot.
For Jen, getting her life back means getting in the pool with her 7-year-old daughter. This moment, once a seemingly impossible one.
My life today, it's changed totally.
With photojournalist Justin Dubois, Jenna Sachs, Fox 6 News.
Compelling. Jenna, thank you for that. Dr. Frank says the SI joint is a source of suffering for a quarter of patients with lower back pain. However, he says most physicians aren't trained to recognize the problem. Used to get shots in those SI joints, I was telling Ted, and this looks like something that's really going to be beneficial for so many who suffer from that.
You think that phone will be